Gina, tell me what's going on. What happened to your shoulder?
Not sure exactly what happened. Just started to get a lot of pain, especially when I work out.
Okay, so how long this been going on? About 2 years. So when you work out, you start to feel pain. Where do you
Yes.
feel the pain?
My shoulder.
So can you give me in the last 2 years what kind of treatment you had?
I've had
Two courses
one
of shots.
recently within the last 3 weeks.
Okay.
I've had 4 months of
Physical therapy.
and before that, a cortisone shot.
Okay.
My ortho doctor would like to do surgery.
Why you want to do surgery?
He feels that's the only way to remove the inflammation and the swelling and pain.
So you had MRI?
Yes, I
For
had an
your shoulder?
MRI,
Okay.
and it showed that my bones are graining on my tendons.
Okay.
And there's a lot of inflammation in there.
So he diagnosed you with bursitis. What else?
And tendonitis.
Tendonitis.
And maybe a little bit of arthritis.
Okay.
He's not exactly sure about that.
But there
There's
is
no tear in the shoulder.
Okay. You want to do surgery just...
Clean it out.
Okay, so you had a cortisone. Did you have any other treatment?
No.
So what is difficult for you to do?
My workouts or even day-to-day work. I'm a teacher, so it's
Okay.
hard to write on the board at times. Sometimes it's hard for me to grade papers. Even sometimes dry. I mean, yeah.
You're right-handed?
I'm right-handed. So
Okay.
I've noticed that I do feel a little pain when I do lift my right arm, so I normally just drive with my left hand.
Okay. All right. So driving overhead activities. Okay. So if we get let me see actually your range of motion initially, and let me know your pain level. How much from 0 to 10?
Okay. So right now, I would say it's about
3, 4. Okay. Is that considered constant pain or
that is
comes and
constant
goes?
pain.
So 3, 4, your baseline, and where do you
Right.
feel it?
In the front part of my shoulder.
And how would you describe that pain? Is it dull, sharp?
It's
aching?
a dull aching type.
Dull aching, constant dull aching. Okay, when you aggravate your symptoms, how much it goes up to?
Oh, it can go up to 10, just depending on what I'm doing.
Okay, so what make it goes
When I weight lift.
when you left weight? Okay, let me see your range of motion and tell me from 0 to 10 if that 3, 4 increase and how much increase.
So
let's do the front.
If I do the front, I'm good till about here. I do the side. Right here, I was popping and there's pain.
How
right
much
here.
from 0 to 10?
It goes up to about a 4.
So that's about 90 degrees here. Okay, so
Just holding it,
Okay.
like this, the pain increases.
how much?
It goes from like a 4 to a 6. It just increases.
4 to 6?
Yeah.
Okay, can you do this?
Can do this fine.
The abduction where you had the
Um,
issue and bring it back.
When I bring it back, not very much pain. It's about the 3, 4 where initially was.
Okay. So basically, this is currently
Right.
that's you
Yes.
get this with abduction.
Or if I have something overhead
Yeah.
and it's heavy,
Okay.
that's what a whole lot of pain.
Okay. So I'm gonna try 2 pounds and a half.
Okay.
Okay. And we'll see because now we had 6 with abduction.
Right.
And, we're
2.5 pounds.
and I want you to lift it up and tell me how that feels. 0 to 10. And overhead like this.
This is about where it was. Right here. Right here. I can't.
How much?
Oh, it shot up to about
7,
the
8.
air higher. Yeah.
Okay. I don't want to aggravate it. I'm just using that for testing. So we'll do the treatment and then we'll test it
Okay.
again. Okay. So your pain is right in
Right
here.
there, yeah.
Oh, sorry.
It's okay. A little bit.
You don't have to scream.
Okay.
That's okay. Relax. Oh, there you go. Now you're relaxed. So it's right in here.
Here.
That's where you feel pain. So where did he say you have the tendonitis? Do you remember
He
the
just-
name of the muscle?
No,
Supraspinatus,
he just
subscapularis.
touched right here. He touched it there, and then he touched up top.
So you like a subscapularis and supraspinatus? Okay, that's might be because we don't have the MRI. Okay, so I'll give you the third injection.
Oh,
Not
thanks.
really.
Thanks.
Relax. And just gonna work on release the tightness there. You have a lot of scar tissue here. But it might be like you're injured with weightlifting in the gym. Okay. Make sure it's not painful.
It's not painful. It's just a constant. It's not super painful. It's just sore.
While I'm working on it, it's more than 3 and 4, let me.
Okay.
Because you have that constant.
Right.
If you feel pressure, that's fine. If you feel
Pain.
yeah.
I'll let you know.
Yeah. So, is it too much?
Ow.
Okay. Is it painful when I touch it there?
It is.
Okay, let me do something else. Because you're really sensitive here. So this has been going on for 2 years, yeah?
Mhm.
Okay. So what did they do in physical therapy?
Just a bunch of different exercises, like up and down
For
ladder.
inflammation and tendonitis exercise?
Just
Yeah?
trying to work on a range of motion,
Yeah.
and then he would try to massage me out.
Yeah, to break the, with his hand, yeah.
Yes.
Yeah. It's hard to break the scar tissue with the hand. And you had it for 4 months. Yeah. You feel this bump here? That's a scar tissue here. So you have a lot of scar tissue. Okay, because you have a little bit inflammation, make sure what I'm doing is not painful, because I don't want to cause more inflammation. I just want to release the tightness only. Do you have any history of head trauma, accidents, sports injury, like fall or anything?
No. Once I was in a car accident and fractured my T1 vertebra, but that's it.
T1. And is it like, did you have any neurological symptoms?
No.
So it was hairline fracture? Okay. But you don't have numbness or tingling
No.
on. So when you hit, did you hit your head forward?
It was
or-
a snap.
Okay.
Just like a
When
forward
that
and step
happened?
back. About 3 years ago.
Okay. So you had symptoms in the neck only?
Yeah, I think it,
Your shoulder
Nope.
stuck with the car seat. Okay. Where else?
that's
So
just,
you had your head forward?
it snapped forward and back really fast. And
And
it
you
caused fractured.
Fracture.
Yeah.
Okay. T1 is just spout right,
Right.
here. The T1.
Yeah.
Uh,
And I didn't even realize.
did you have symptoms or you were
The fire department that was there, they said, "Do you feel any pain?" I said, "And I was walking around, I was fine." And I said,
Afterwards, sometimes you will not feel
I
it from the
just
shock.
sat there and I said, "You know what? My neck started to hurt." And they strapped me
Okay.
immediately.
Okay.
And
Yeah.
the x-ray didn't show up, but the MRI did.
Okay. So it was minor.
Yes.
Okay. Alright. How's your neck now?
Fine.
Your neck.
Fine.
Yeah, okay. Make sure what I'm doing here is not painful. Okay. Too much, or it's okay. Okay. Any other accidents or trauma? Is it too much what I'm doing?
No.
So, like most of the time, the 2 points of pain
Yeah.
here and here. Okay. Okay. So you do a lot of typing or writing.
Writing and typing.
Yeah, the problem when you are right-handed and you actually injure your right shoulder. Is it too much?
Too much.
Well, it's sensitive.
Yes, it's very sensitive
Okay.
there. You're the only doctor that has gone down that far. Actually noticed that there was.
Down here? Really?
Even my therapist didn't even touch down there.
Touch it here? Because it's prohibited area.
Really?
No, I'm just Yeah, the whole body's connected. It's one
Right.
piece. We cannot
Just
focus on this because a lot of muscle attached here to here. So if you have, so think about this way, okay? Our muscle should act like a rubber band. When it contracts and relaxes, it does this. So when we have a scar tissue from accident or trauma or poor posture, it's similar to having a knot in the rubber band. So when the muscle contracts, does not stretch much. So it actually does not make sense when you come with pain here, just focusing here and ignore the rest of the muscle. If I ignore the rest of the muscle and your scar tissue here, does not matter how many years you've done work here, you already had 4 months that were
Right.
here. That's where not releasing the area that has tightness. So I have to release the whole thing to actually be able to affect this muscle that's pulling. So that's why actually we're going to work on the neck too, because there's a lot of muscle
Okay.
attached this
did
way.
that way as well.
Yeah, think about the body is like a chain.
It's like a chain, yeah.
So if you have a tension in one end of the chain, there is 3 options for the problem or the pain. First option is the location of the tension. Second option, your weakest link in the chain that compensating for the tension. Third option is all of the above. So how do we know that? We have to evaluate it and think about the body as one piece instead of try to say, oh, this is a shoulder patient. I'm like, it's never shoulder only. It's never shoulder only. Because we cannot take this out and leave the whole
Leave it.
body by itself. I hope not.
Really?
Yeah, I feel a lot of tightness here because you said you do a lot. Feel that? Feel this knot?
Yeah.
That's a scar tissue. Sorry. Okay.
Okay.
She's smiling, but that's a smiling face. All right. So let's actually put a pin here. Sorry. Oh, this is coming. So we're gonna work on this. Is it painful?
Just a little painful.
Yeah, I just have a little bit of inflammation. Okay. Is that painful?
Yes, a little painful as well.
So what happened here? You have thicker scar tissue here.
Yeah, I noticed that the other day we were doing something. I said, "Why does this side hurt?" But I was like, okay,
Hold on,
only my
hold on a minute.
Right.
Here. We're gonna do the exercises here. I will test it before going to the gym. The exercise you wanna do in the gym. If you're ready to do it, if you do it here without pain, you can do it in the gym. If you still feel pain, we need to figure out what's going on and work on it here. But I feel more scar tissue here than here. Okay. So let's actually work on breath. Hold on. Make sure that's not painful. Okay, you hear that grinding? That's a scar tissue. And here, I don't know. 1 second, I want to make sure this is getting the. Yeah, it's getting the shoulder. Oh. So actually, you see the jumping?
Yeah,
of the
yeah.
Yeah, the aster tool. So it's here. See that? Okay, that's a scar tissue. Here, a lot of grinding here. Feel that? It should feel like here. It's a little bit grinding here, but here, that's a scar tissue too. I try to give you a good example. Just take my word. It should feel smooth, like a little. I want to give you a good example. This is a good example. Feel how nice and smooth it is?
Right.
Compared
with the grinding.
grinding here. So that's a lot of scar tissue. Want to make sure you really feel that bumpy here.
Yeah.
Okay. So there's one scar tissue here, but here there's a lot. Back
Yeah.
to back.
Right.
See, it's like grinding.
It's the whole
going-
arm.
The whole arm. Yeah, that's a lot of scar tissue here. You hear that?
Yeah.
So you hear
can
the
see
sound, and you can see the redness
Right.
where you have the scar tissue. So all the scar tissue, because the muscle connected,
Yeah,
you
it's
know,
all-
it's gonna restrict your range of motion. It's a little bit here. So this, they did not even touch any of it. Okay, make sure this is not painful. Actually, you have relax. Are you
Oh.
relaxing?
I'm trying to.
All right. Okay, because I see you're
Yeah.
shrugging your shoulder. So you feel that here.
Yes, it's
Okay.
my pain area.
Sorry. Was that painful what I'm doing?
No, it's not painful now.
Okay, so we get the scar tissue all over this area. A little bit here. You feel that?
Yep.
Okay. Get a lot of scar tissue here. Okay. So I'm gonna get in here, that spot.
Okay.
Make sure you don't feel pain. Okay? Because I don't want to close. Relax.
Go ahead.
There you go.
It's not increasing any pain.
Okay. But you heal.
It's just
you
I'm
feel that
scared.
grinding. Yeah, you guard it. It's very normal. Is that painful here? You feel that grinding?
I feel it,
All
yeah.
of that. Is that too much? You feel that?
Yep.
Did they work on this, Eric?
That's where he would try to massage.
With his hand?
Yes.
Oh man. Too much? Get a lot of scar tissue here.
Yeah.
That's very thick for the small area. So that's gonna cause a lot of issue here. So they want to do the surgery to clean it up.
Yeah.
So when you have cut, what's gonna happen?
That's an issue. That's a problem.
Your body gonna build up new scar tissue.
Right. It's gonna. Yeah.
Do you guarantee the cut from the surgery gonna be less scar tissue than the old scar tissue?
I think it's gonna make more because even though he says he's gonna clean it out,
It's hard
even
to-
though when you remove something and you're
Yeah.
cutting, it's gonna a
Yeah.
scar is gonna grow over that cut.
To heal, because if your body does not build the scar tissue, it's open wound. You need the scar tissue to heal.
Yeah.
But do you, like, who can guarantee the new scar tissue
It's
actually
not-
going to be less than
Right,
the
than
old
the
scar
old,
tissue?
right.
Yeah, that's a problem. Is it too much? You feel that?
I feel it.
Yeah. You feel all of this. Okay. And you- Oh, you have plenty. Okay. So, make sure that's not too much, okay? Do you have water with you?
Yes, I do.
Okay, I'll give you some water. Okay. Let's actually clean this up. And I want you, the motion that you had trouble with, okay, is the abduction. But I want you to tell me your constant pain, because you were saying your pain was like,
3 and 4.
okay, how much is now? Let's drink some water and tell me the constant pain. Did that change?
It has changed. It doesn't.
Let's drink some water. You can see actually the scar tissue where you have the redness all over this area. 0 to 10, how much is now?
I don't feel. Let go.
Let's do the abduction, see how far you can go. Oh, you're going further a little bit.
Yeah, just here.
Where you feel it? Okay, how much? So you went a little bit further.
Yeah.
How much?
It's right here about 3, 2 to 3.
That's
Not
it was
bad.
90 degrees now. So you
right,
can
this
like
right here. I don't know if it's because it's flex, but we're looking at like your 3
make sure
or 4.
Okay. 3 and 4 in the back.
Yeah.
Okay.
Here.
And okay, so let's actually do this. Rock here. That's very tight. Okay, is that painful here?
It's just sore.
Is that increasing the soreness or is it?
A little bit. Like right now, I don't feel it until you apply pressure.
What about now?
No.
No. Okay. Make sure it's not too much. Yeah, you get a lot of scar tissue here. Okay. You get it like a little bit like this. So, yeah, you get a lot of scar tissue here. Is it okay to take your necklace off?
Yeah.
I do want to get some lotion in it. So this side here. Okay. Yeah. There you go. Did any more work on this area?
No.
This is another part of the area, okay? When you work on the shoulder. Any back issue? Oh, you had the neck issue.
Yeah.
So the fracture was on
It's
the
on,
side?
yes, on the left
Okay.
side.
Okay. That was 3 years ago. Okay. You're gonna feel cold again. Get some work to do here. Okay, is that painful here?
Yes.
Okay, all right. Okay, I'm glad you're not painful. Is that too much?
No, it's not too much.
Okay, relax. And here. Oh, okay. Alright. So it's gonna feel cold again, okay? That's definitely a lot of scar tissue in this area. Visually, you can see the scar tissue sticking out. It's like a thick. You feel that?
Yes.
So your scar tissue here in this area, it's I think the size of a small tennis table ball.
Okay.
It's a little bit smaller than that, but
Okay.
it's on the bigger side.
Right.
On bigger size of scar tissue. Any neck issue? Okay. So yeah, it's a big one. Gonna work on that more. Yeah. Ah, there you go. So I got it in your hair.
It's okay, it's fine.
Okay. Okay. So let me close this. I will have you actually drink some water.
Okay.
More water. Okay, and turn it around, and I want you to do the abduction again. And tell me how that feels.
A little better.
Where do you feel it now? How
Slight
much from
cool.
0 to 10?
Slight
Cool or pain?
both.
Okay, how much?
And it's at 3.
Okay.
Two,
This
four.
part is 3, 4.
Here I don't feel it at all.
So it's it's catching in here.
Right.
Catching in here. When you clear it,
When I clear this, I'm good.
you're good. Okay. So let's actually lie in your back. Head. So it's right into your
Okay.
Yeah. And relax. There you go. Okay. Make sure you breathe. Lift your head up. We'll do this on the side. I don't want to pull it. And relax, relax. Okay. Is that too much what I'm doing?
No.
Okay. Relax, relax. Make sure you breathe, okay?
Yeah.
Are you breathing?
Yes.
Okay, we need that here. Okay. Tender here
Yeah.
and here, okay. Push my hand. Push, push, and relax, relax. Push and relax, relax, okay. Okay. I want you to push my hands here. Push, push, push. What? Up, upwards, sure, sure. You're breathing?
Yes.
Okay, I need to hear you breath. Okay. All right. Yeah. As long as you're here, we want you to breathe.
I'm breathing.
Okay, if you don't want to breathe outside, go ahead, but here, make sure you breathe, okay? All right. Is that too much?
No.
Okay.
It's just sore.
It's the whole thing. You have inflammation there. So I'm actually gonna work on try to release the scar tissue, the fascial restriction, the trigger point of muscle spasm that related to the proliferation stage. So if we get you 4 range of motion without pain, That's mean you don't have a lot of inflammation. Okay, so it depends on your response today. We'll know if you're purely stuck in inflammation stage or going back and forth between inflammation and proliferation. And for who watching the video, to learn more about the stage of healing, you can check what is after video. The link gonna be on the bottom of this video to learn the normal healing cycle, which is 3 stages: inflammation, proliferation, and maturation. We have another video on that. Okay. So push my hand down. Relax, relax. Okay. Tender here. Man, you're really tight here. Tuck your chin. Okay. And relax, relax. Let's tuck it again. Get a scar tissue here.
There.
And
Right.
relax. Yeah. Right here in this knot.
Right.
You have issue here, yeah. You
I
sure?
feel that I'm always trying to compensate for this side of my body.
Do you, yeah, like you tilt your
Right.
head. Do you feel those knots?
Yeah, I do.
Yeah, okay. Man. You sure you don't have neck issue?
No.
Okay, because you have a lot of scar tissue. You probably, because you feel a lot of pain here,
Mhm.
you're not realizing the tightness.
Right.
Your brain's just gonna focus or,
On my shoulder.
yeah, preoccupied with the strongest painful signal. Alright, let me know if it's too much. Okay, let's sit up for me and tell me how that feel. Let's move your shoulder. You can actually have a seat. And let's move your arm. How's that?
Right here.
You're stuck in, right in
Right
here.
here,
Where
yeah.
do you feel it stucking?
The back of my shoulder.
The back
Back.
end of your shoulder. Okay, so you're already stuck here instead of stuck in the 90
Yeah.
degrees.
Yeah.
So you gain like at least like a 30, 40 degrees and you feel it and
Tendon.
okay. So I will have you lie on your back, head on the other side. Yep, head there.
It feels almost sometimes you sort of pop, but it's not going to.
You want to pump your shoulder.
Yeah, but it
It feels like it's stuck. So where do you feel it stuck? In the joint itself or outside?
a little outside.
Outside.
Yeah.
Okay. This is what I want to work on. Relax, relax. Are you comfortable like this?
Yes.
Let's pull this down. Okay, did anyone work in this area?
No.
It's another prohibited area,
Yeah,
okay?
yes, so.
You cannot work that in PT.
It's not.
Okay, you feel the scar tissue here?
Yes.
That's a big here. That's a very thick knot.
They don't touch me.
Yes.
They only touch the external
Okay.
shoulder stuff.
Are you comfortable in that position?
Yeah, I'm fine.
Okay. Is that painful? Is it okay?
Ooh, it's a little
Oh, you don't like this one. Okay. What about now?
thing. I'm good.
You okay? Okay. Think about something you like. What do you like?
Food?
What kind of food? Okay, if it's good food, you can say it here. If not food, don't say it. You can say it. Doesn't matter. Yeah.
I like Vietnamese food.
You like
Mediterranean food.
Mediterranean. I like that too.
Can you
Yeah,
relate?
that's cool. Is that what you cook?
Sometimes, not all the time. Just
yeah. There's a lot of recipe that's healthy. Actually.
yeah, not all the oil, but
Olive oil is good for you. If it's an extra virgin organic
Yeah.
oil,
Right.
that's good
We
for you.
eat-
You don't want to heat the olive oil.
my husband tries to cook with it.
Cook
With it, yes.
Yeah, it has a smoke point, I think.
Right,
It's
it has that-
350.
yeah.
So if you start to see smoke, that's actually turned to toxic. So you can heat avocado oil, but olive oil, I will be very conservative
Exactly.
with
Right.
it.
Tell
Yeah,
him that.
but yeah, I like olive oil.
Although recently I haven't put
Mhm.
it in my salads, I just use lemon and salt.
In your salad, lemon and salt. Yeah, you can use vinegar, Himalayan salt is
Yeah.
good for you. Is that too much? You feel the thickness of this scar tissue?
Yes.
Is that too much? Make sure you tell me. Okay. That is. You feel that?
Yes, I feel that there.
Excellent. What else do you like? We don't talk about the ice cream. Chocolate or anything.
Right. That was great. I had a
Chocolate
really-
is, if it's dark chocolate, is okay. As
No.
long as there's no other junk in it.
Milk. Milk chocolate.
Not chocolate? Yeah, if it's raw or getting, that's okay. Yeah.
I had a really good ribeye steak this
Oh, nice. Okay. You make me hungry.
I'm sorry.
Okay, that's okay. Talk about it. It's fine. I will have a meal after this.
Yeah.
Yeah.
My students think I have a shopping issue.
Why? Shovel out.
Yeah, I've had a lot of
Oh, okay. Yeah.
That
Sorry.
goes-
What you feel that bump here?
Yeah.
It's a thick scar tissue. Yeah, that was really. So you have a lot of
I have
shoes.
a lot of shoes. And they noticed under my desk I have like 6 pairs of shoes.
Oh my goodness! There were 6 like in the same day.
No, see, I'm
You
going
changed
to
it based on
I
the weather
change
change.
based on how I feel. If I don't want to wear heels, then I have flats. Or
Oh, okay. I don't recommend heels, but
if I'm walking a lot, I want
Yeah.
a different flat than.
yeah.
Or I'll come to school wearing sandals. We're not allowed to
Yeah.
wear sandals, so I switch.
Oh wow.
So
Yeah.
they notice.
You like
You-
shoes.
You never wear the same pair of tennis shoes.
Oh wow. Yeah.
So, yeah, I have a shoe problem.
Is
That's
that-
why I have a
is that your
job.
hobby?
That's why I have a job.
You know, if it's too much here, like the scar tissue is so thick that you visually can see it. Look down. You can actually visually see it stuck out. Yeah. You feel how softer now?
Yeah.
It was really like I
Right.
feel like a rug. So I shaved a little bit. That's gonna take us few treatment to really shred
down.
of that. So that's gonna pull your shoulder down and it's gonna restrict your range of motion. Yeah, feel this here. Let me know if that's too much. Oh, okay. It's too much.
Yeah.
Everybody knows that's too much. Is that too much?
Not too much.
It's just sit up for me. Okay, we'll get you some more water, and we'll have you lift your arm up, and let's try it again.
But again, it's catching.
Where it's catching, let me see it. How far? Pain or just catching?
Just catching. Not as, just a little slight bit
Okay.
of pain.
Where do you feel its catch?
In my shoulder. Where in my shoulder?
Where is it in shoulder?
Along this muscle. So if I draw a line, just goes down. That's the muscle.
Okay, so let me work on that. So how much pain when you did this?
Not very much.
Relax.
But
Okay, let me get you a pillow in here. This is not. I actually let's have you sit in here.
let me say.
Yeah, so I guess. Okay. Relax. It's
Right there, where your thumb is.
Okay,
Yes.
is it painful?
A little sore.
It's still sore?
Just a little bit.
Okay, relax. Okay. Too much?
Not too much.
Okay. So it's catching now.
Yeah.
So the catching was 90 degrees, now the catching.
It's up, yeah.
So you have a scar tissue that when you get in that range does naturally it grow and it clear up. That's typical. The impingement syndrome is usually this range. So that scar tissue causes impingement in there and decreased range of motion. And when it's cleared, everything you can go farther. Okay. Is that too much what I'm doing? Okay. How does it feel?
Pressure.
Okay, those aster maneuvers I'm doing release on those areas at much because you're not tolerating the tools with certain spot. How does it feel? Okay. You feel this one? Yeah. Yeah, you have plenty to work on. You're gonna keep me busy. Okay. Alright. Too much is okay.
It's okay.
All right, so what I want you to do is just to sit here in the middle and try the range of motion again. Up.
Good.
Wow, that's a full range of motion. Is it catch or it's...
Not really, no.
Okay, let's do 5. Are you guarded, yeah?
I'm scared.
Are you trying to figure out is real
Sure it's
or...
real? Yeah, we're good.
Oh my gosh, look at this. You try to show off now?
No.
Okay, so we try, so the abduction was 90 degrees, now you're actually going further. We're gonna try the 2 pounds
No,
and a
but
half.
mine-
Make sure you thumb
yeah.
up when you do that. Okay. Let's try this and go up. If you feel weaknesses, that's okay. You're gonna feel
Weak.
weakness, that's normal because I don't know how long you've been not doing this. But my concern is the pain. What do you feel?
pain, right?
Okay, stop. Okay. Sorry. Where did you feel the pain?
Around that same area,
Where?
backside of the muscle.
Okay. Sit up nice and tall. I want you to try it again. You're probably not ready for weight. No, we're not ready for weight.
Either
Minute.
holding it, just
Without weight.
holding it.
I don't want you to do weight
Okay.
now. You're not ready for weight. We're going to do it later. But I just,
No.
today I care about the range of
Range of
motion.
motion,
We're
yeah.
going to do more stuff for the weight. How is the range of motion now?
Great.
Okay. So what do you think about the treatment? Just move your arm around and tell
I
me.
feel great.
You had physical therapy. So
Form-
can you tell the difference between Aster and
Oh,
traditional
yeah.
physical therapy?
Yeah. I didn't feel like physical therapy was even helping me. All it was just
Uh-huh.
sometimes just a bunch of stretches. Some days
It's not going to break the scar tissue, the
No.
stretches and exercises.
And
Yeah.
that's for walking on
Yeah.
the ladder, and that
Yeah.
was it. And or pulling on a band.